From the News Channel 5 Network, this is OpenLine.
Well, good evening and welcome into Open Line. I'm Chuck Long, and as always, glad to be along with you for the next hour. Now, Open Line tonight, we are taking on a new topic. We're talking about mental health for the next hour. And this is a topic that sometimes people don't know exactly what they should say, the questions that they may have. Sometimes they're not sure or comfortable asking, but we want you to know that you can ask any question, comments. We welcome them as always. We are extremely excited to be welcoming Dr. Karen Ray. She is a psychiatrist, and it is good to have you with us for the evening. And I know, Dr. Ray, there is, in addition to talking about mental illness, mental health, some exciting new treatments for it, this is also a week that is recognizing mental health. So could you tell me a little bit about that?
So this is National Mental Illness Week, and then on Saturday we have International Mental Health Day. The World Health Organization is sponsoring that day.
Which is terrific, because it brings more awareness. And have you found, and I know that you have talked to many people over the years, that it is often the subject that people don't know how to talk about, or they're afraid to ask certain questions about it. How is that progressing? Are we getting better about that?
I think we're getting better, and I think the media is largely to be thanked for the increased awareness. What I'm seeing with my teenage patients is they now introduce me to their friends in the mall. So it's beginning to be more accepted, I think, in the South and in Tennessee, to have a psychiatrist, to see a therapist, to be engaged in treatment.
And you know, and a lot of times when they are almost afraid to say mental illness because they feel like there's a stigma behind that. How are we helping correct that?
Well, I think as we learn more about the science behind these illnesses, and as we learn what might be used to cure the illnesses, I think that's really creates a lot of hope. And what we really need in treating mental illness is hope for recovery.
And you know, one of the things that I was thinking as I was preparing for this tonight is, if someone suspects that someone has a mental illness, what approach do you recommend they take? Do you suggest to that person, I think you need to see a doctor, or do is it a group, effort of approaching someone? What is the right way to do that?
Well, I think if it is an adult approaching another family member, it really would be good to speak with that person, to find out how they're feeling, to mention that you've noticed that perhaps they aren't feeling as good as usual. And then it would be important to look and talk about what they're doing that they normally do, what they're not able to do, that they've always enjoyed. Have they quit enjoying their life? Also always look at sleep, because sleep is often precedes mental illnesses, sleep disorders. So look at sleep. I look at appetite and energy. And then if the person is resistant, I recommend beginning to talk to other family members or friends to try to get more support for the person seeking help.
And now, one of the things that I wanted to mention too is your company is CenterStone, and basically says the art and the science of behavioral healthcare. So tell me a little bit about CenterStone.
CenterStone is a large community behavioral health provider network. We have clinics throughout Middle Tennessee. We have a very broad array of services. So in addition to psychiatry services, we provide therapy, we provide case management, we have other programs for people who have serious mental illness. We have school-based services and a large number of grant-funded programs.
Okay, and as always, we say this is your forum. The number is on your screen. You can call us at any time throughout the hour. If you have questions, if you have comments, 615-737-7587 is the number to give us a call. And like I said, it is an open forum for you. So don't be afraid to ask any question. We love to hear from you as always. What would you say some of the past treatments, just the traditional treatments, when someone comes in with a mental illness have been?
Well, I think many people will have had counseling, psychotherapy. They perhaps will have had individual psychotherapy. They may have had family therapy. And many times these are successful, but many mental illnesses are episodic. So there's a period of illness, a treatment response, and then a period of relative improvement, and then they might have another episode which led to their returning.
And what are some of the treatments? Is it often medication? What would that be?
We would use medication for many of the psychiatric illnesses. I guess the one that we always think of is treating depression, and we do treat relatively mild to moderate depression with psychotherapy. Sometimes people don't want medication, but for most people who have moderate to severe depression, they are treated with antidepressants. Some of the ones we've all heard about would be Prozac, Paxil, Zoloft, Effexor, and there are a number of medications. And there have been, since the early 2000s, we have really seen many newer antidepressants come into use.
And when you're talking mental illness and you mentioned depression, it's interesting because I don't know that or I think some people do wonder, depression, is that a mental illness?
Depression is a mental illness. It's a psychiatric disorder.
And what are the signs that someone actually has depression, as opposed to just being out of sorts or just in a mood?
Well, I think a big issue is how long the depressed mood lasts. If it's a day or two, that might just be a feeling sad. And I think there are many times when people are sad. It's always an issue after there's been a death to decide if someone has a more typical grief reaction or has a major depression that's developed. Depression in general has the loss of the ability to experience pleasure. So not enjoying life anymore, changes in eating, changes in sleep, changes in energy, talking about not seeing a future, feeling hopeless, feeling helpless, and then of course we always worry about suicidal thinking and plans.
Right. And in that case, and we talked a little bit about, when you suspect that someone has certain signs of a mental illness or depression, that kind of thing, what would you recommend when someone encounters, whether it's a very good friend, a casual friend, a family member, what is the best course of action if you really feel that they need help?
Well, I think the first caveat is that if there's suicidal ideation, especially with an intent or plan, then those individuals really need to get help immediately. And that's an emergency. It needs a crisis call or a trip to the emergency room. So if we take that as the first level of severity, then for other patients, they might go to their primary care doctor, they might go to their minister. If it's a child, that person might go to the counselor at school. And then many of those people would seek a therapist or a psychiatrist in the community. And of course, CenterStone would be a good example of where many people might choose to get help. And then there are always, spread through the community, many excellent psychiatrists and therapists in private practice.
Do you find that there is, more often than not, a resistance to get help?
Well, I think there is a division in that. There are people who come in wanting help desperately, And then there are other people who are very resistant. Sometimes people who have seen illness, mental illness in their families are very interested in getting help. Sometimes patients who are very miserable are interested in getting help. I think once one reaches a certain severity, particularly patients who have disordered thinking, then insight might be pretty limited about needing help. So it really presents in various ways.
Okay, well that is good to know, and that's great information. We are going to take a break, but again, if you have questions, maybe you're out there and you have some of the questions about some of the topics that we have already covered, we would love to hear from you. 737-7587 is the number to call. There are some new treatment procedures that I know that you're very encouraged by, so we're going to be talking about those when we come back from the break, so come on back with us.